Hello, everyone. Welcome to our virtual learning community, establishing peer-to-peer services for adult Latinos in recovery, providing strength, hope, and overcoming stigma. My name is Maxine Henry, the project co-director for the National Hispanic and Latino Addiction Technology Transfer Center. I will be your host for today's virtual learning community. Before I introduce you to today's panel and moderator, here are some brief instructions about today's virtual learning community. This session will be recorded and archived for future playback. The lines will be muted throughout the presentation so as to minimize background noise and other interference. When we get to the Q&A portion of our virtual learning community, which will be at the end of our session, you will have an opportunity to ask questions by typing your questions into the Q&A box, and I will present your questions live to our panel. We will also be asking you to fill out a brief survey at the end of this virtual learning community. This satisfaction evaluation is important to the work we do and provides us the opportunity to improve our training efforts. So let's begin. I would like to start by introducing the National Hispanic and Latino Addiction Technology Transfer Center and our team. The National Hispanic and Latino Addiction Technology Transfer Center is housed at the National Latino Behavioral Health Association, which we affectionately call NALBA, which is located in New Mexico. NALBA was established to fill a need for a unified national voice for Latino populations in the behavioral health arena, and to bring attention to the great disparities that exist in areas of access, utilization, practice-based research, and adequately trained personnel. The NALBA's executive director is Fred Sandoval. Our ATTC is part of the Attc Network, which is an international multidisciplinary resource for professionals in the addiction treatment and recovery services field. Established in 1993 by the Substance Abuse and Mental Health Services Administration, or SAMHSA, the ATTC network is comprised of 10 domestic regional centers, 6 international HIV centers, which are funded by PEPFAR, 2 national focus area centers, and a network coordinating office. Together, the network serves the 50 U.S. states, the District of Columbia, Puerto Rico, the U.S. Virgin Islands, and the Pacific Islands of Guam, America Samoa, Palau, the Marshall Islands, Micronesia, and the Marina Islands. The international HIV ATTCs serve Vietnam, Southeast Asia, South Africa, and Ukraine. Here you will see a map of the U.S.-based ATTCs. The National Hispanic and Latino ATTC has a national focus for Hispanic and Latino communities and the workforce that provides services to these communities. Our ATTC is staffed by Dr. Pierluigi Mancini, who is our project director, me, Maxine Henry, the project co-director, and Ruth Yanez, our executive and administrative assistants. The National Latino Behavioral Health Association is also the home of our sister TTC, the National Hispanic and Latino Prevention Technology Transfer Center. We'll be providing contact information at the end of this session. Now, I would like to say that we are honored to present our 3 panelists and moderator for today's live panel. Let me begin with the panelists. First, we have Angel Galvez. Mr. Galvez is first in his family to receive higher education, works in behavioral health, which has allowed him to achieve postgraduate advancing research from 2 different universities in 2 different countries, in Colombia and in Japan. This experience provided Mr. Galvez important awareness related to global mental health care disparities, and his work experience transcends to issues faced among Latinos. Mr. Galvez has extensive behavioral health and substance use disorder experience working with minority communities, such as African American, Latino, Asian, LGBTQ, and Native American communities. He works with these communities in California and has formed partnerships whereby behavioral health services to these populations in the most poverty-stricken and vulnerable areas, such as labor camps, reservations, rural and county boundary areas, have provided Mr. Galvez with great understanding of optimal practices that can best serve these communities. Mr. Galvez has developed unique seminars, webinars, and other educational materials that are described as cutting edge in its evaluation. He is a sought-after speaker and trainer, both in the United States and abroad. What is most impressive about Mr. Galvez is he has overcome poverty, living in Tulare County, which is the poorest in the state of California, and has overcome drug and alcohol addiction to cocaine, methamphetamine, and other substances. Thank you for joining us today, Angel. Next, we have Xavier Alegre. Javier is a person in long-term recovery from addiction and a passionate advocate for equality for minorities in Utah, especially for the Latino Hispanic community. Javier has worked in the nonprofit sector for more than 15 years in various roles. His prior employment was with the Utah Support Advocates for Recovery Awareness, known as USARA, where he served as the development director. In this capacity, Javier helped grow the organization from a 5-staff small recovery community organization to a 25-staff medium-sized RCO serving all major urban areas in Utah. A large portion of the rural communities heavily impacted by drug, alcohol, and opioid use disorders. Javier holds a college degree in business administration. In the fall of 2017, he graduated from the Nonprofit Academy of Excellence program at the University of Utah and is currently enrolled in the Executive Leadership program at the Eckley School of Business, also at the University of Utah. Javier, thank you for joining us today.
Thanks for having me.
And then we have Vera Molina. Vera Fuertes Molina. I apologize, Vera. She is a person in long-term recovery. She serves as the operations manager at Peers Empowering Peers, a recovery community organization in Atlanta, Georgia. Vera is a certified peer specialist in adult mental health and adult substance use disorder, and is a trained facilitator in cultural competency and trauma-informed care. She is working to expand the Latino peer workforce in the state of Georgia by raising awareness in the Latino community of the programs offered, supporting peers in the application process, and advocating for the training to be accessible in a culturally and linguistically appropriate manner. Vera, thank you for joining us today. By the looks of this panel, this is going to be an amazing hour and a half. Last but certainly not least, it is my pleasure to introduce our moderator for today's session. Yvette Torres is the former Associate Director for Consumer Affairs at the U.S. Substance Abuse and Mental Health Services Administration, Center for Substance Abuse Treatment. During her 20-year career at CSAT, Ms. Torres led the team responsible for development of public health education and social networking efforts, including the role for the coordination of the National Recovery Month observance held each September nationwide, and was the executive producer and host of the Road to Recovery TV and radio series. Prior to her federal service, Ms. Torres was a senior director of communications at Consumers Union, publishers of Consumer Reports magazine, where she integrated the roles of 4 departments: Information Services, Office of Public Information, Radio and Special Programs, and Consumer Reports Television. She served as a senior professional associate for media at the National Education Association and as vice president for development at what is now the National Hispanic Health Alliance. She holds a master's in education from Northeastern University in Rehabilitation Administration and a master's in science from the George Washington University in Telecommunications Policy. She is also a former alumnus of the Community Fellows Program of the School of Urban Studies and Planning at the Massachusetts Institute of Technology. Thank you, Yvette, for joining us today and for moderating this great conversation. I will turn it over to you, but before I do, I would like to say Happy Recovery Month to everyone. This is such a great way to celebrate it. And also, most importantly, happy Hispanic Heritage Month. So every September 15th through October 15th, we love to honor our culture, our people, and I can't wait to see how this next hour goes. Thank you, Yvette.
Thank you, Maxine. And I want to thank you, Maxine. I want to thank Fred and Pierre-Louis, Dr. Mancini, for putting on these wonderful video learning sessions. We did one very recently, which will be posted on the NELBA website and on the ATTC website, related to youth peer-to-peer. And today I'm very excited because we do have an incredible panel to talk about the adult peer-to-peer experience. We're going to cut this into 3 different segments. First, we're going to talk about the who, what, when, where, and why of peer-to-peer. Then we're going to move into why is it important to consider the adaptation of peer-to-peer services, or the establishment also of peer-to-peer services for, by, and about Hispanics within the context of those that are seeking help from their addiction or their mental illness. And third, we're going to cover how can we overcome the stigma that really is a very negative factor, I believe, in the delivery of services and in motivating individuals to seek services. So I'm going to start today with Angel. And I'm going to ask you, Angel, can you describe for us, you've got a vast experience in dealing with peer-to-peer services. Can you describe what we mean by peer-to-peer and some of the components that are integrated into peer-to-peer services?
Sure, thank you. First of all, thank you so much for inviting me to this panel, Nelba, and all of you who put this together. I hope that what I offer to you today is valuable and you can take back to your communities and apply it. I am 42 years old. I have been in a peer-to-peer, if you will, model and working within that model for the last 15 years. So that's my experience in a behavioral health setting or social services setting. I would say that a peer-to-peer is someone who has a lived experience that other peer is experiencing in their life in that moment. And so my peer-to-peer experience has always been around really alcohol and drug use, more specifically drugs like cocaine, drugs like methamphetamine, and drugs like heroin, which plague our communities in the Central Valley here in California. So my first experience with the peer-to-peer setting was really around wraparound services. For many of you, you know the Wellness and Recovery Action Plan model from Mary Copeland. And I think that at the time when we were implementing peer-to-peer many years back, we were taking from that model, but really identifying it of how to best use it within the Latino adult community. Because of course, we adults, and I consider myself an adult, I'm 42 years old now, is we were brought up differently, especially my parents being migrant from Mexico, living in a community in the Central Valley and working in the fields. We had a culture that identified us, we had a language that identified us, and we had an upbringing of how to really handle peer-to-peer interaction. So that all compounded really the way we would discuss peer-to-peer interventions. And so that's kind of a little bit of that.
Well, do I walk in as a person either seeking recovery or in recovery, and what happens to me? I go, hello, I have an issue with addiction, and when I walk in, what happens to integrate me into the program if I'm interested?
Well, the first thing is I want to recognize that approximately 90% of the people that are alcohol or drug users, and I'm talking about maybe ongoing or casual social, never seek out treatment. So you're talking of a very small percentage of those that do, and when they do, we would try to be equipped to be able to wrap them and integrate them into services. So from, like, say, for example, through a behavioral health system, the peer-to-peer model really came to the behavioral health system not too many years ago here in California. So from the nonprofit world, we would recognize these people and we would try to link them to the services. So let's say somebody was requesting detox. They were everyday users, homeless, nowhere to go. We would encounter that person and say, look, we have these various housing opportunities. Some are faith-based, some are non-faith-based, and then really walking with them in their shoes and assisting them in trying to gain those services. So we as a peer
you would definitely refer them, assess them, and then refer them to the appropriate services if they're not in recovery. In fact, if they are in recovery, then you assess what their needs are in terms of their overall strengths that they bring to the table, so you can work with them to sustain their recovery. Some of you all of you are in recovery. Did you, when you were seeking recovery, did any of you seek out peer-to-peer services?
I never did.
No.
I didn't either.
And how about you, Vera?
I did not seek out peer-to-peer services in the beginning of my recovery, but I can say being a part of the peer community sustains my recovery now. And additionally, just talking about what do you do when you first meet a peer, here at our recovery community organization, Peers Empowering Peers, we start off with a check-in, and we have a peer conversation. We just like to get to know that individual, get to know what they're passionate about, what supports them, and then as Angel was saying, like, see what resources we can refer them to.
Very good, excellent.
If I may add something, at my previous job as a peer mentor or as a peer coach, that's also what we would start with. We wouldn't begin the process with assessment or forms or surveys. We just want to first probably sit down or have a cup of coffee and have a conversation and see if the person is comfortable. If it's not, maybe you're not the best fit. We bring others to the table and see who the person gravitates to make sure that they have a rapport from the beginning with the person that is going to be helping them.
Well, what I want our audience to understand is that while peer-to-peer, and it's very important what all of you have noted thus far, peer-to-peer really incorporates aspects of mutual support, but it also incorporates aspects of case management. Because what you're doing is you're really assessing the individual, and you're looking for ways in which different services can in fact support the recovery process. Why is it important? And the Latino community, many agencies and many areas of the Latino community really, number one, don't have peer-to-peer services. But why, in your view, do you think it's important to go ahead and provide services to Latino folks in recovery? I'll start with you, Javier.
Well, I've worked in the peer-to-peer recovery support services for quite a bit, for quite a while now, and I have observed the tremendous impact that it can have in someone's life. Like Vera said, peer support and peer services and my peers support my recovery now, help me stay in recovery and help me to have a network and a connection to a community that understands where I am and what I'm going through at some certain points in my life. In Utah, there is a lack of services, as I would assume in most states, for Latinos. There are services, but they're not culturally or linguistically relevant, and that is a very important aspect for the services to be efficient. So I think because the model is an evidence-based model, is being proven to be effective, I think adaptations that are evidence-informed need to be considered and developed to begin the process of having evidence-based practices for Latinos that can be supported by funding sources and other organizations. Like Yvette, I think you'd mentioned this to me before. So it's like there are other organizations, and we have to make sure that we integrate ourselves or the Latino community models and programs into other organizations as we start to develop our own programs and our own services across the country.
Right, and as we talk about that adaptation, because there are various issues that Latinos bring to the table, such as language and culture, and even diversity within our culture. So Vera, if you were setting up one of these programs for Latino communities, what would you point to are the most important points to remember in terms of that adaptation to Latino audiences?
I think for me, what we're going through right now in Georgia is really just having the awareness that these programs exist. So the first thing that I would have to do is intentionally set out to create an awareness of these services or any developing program. And then I would want to make it accessible. And that goes back to creating staff, though, which is another huge barrier, which also is relative to awareness. So those would be the first two things that I would look at.
I don't want to lose sight of Angel because he's not on my screen, but I do want to hear from you, Angel. Anything to add to what Vera just noted?
Yeah, I think Javier really nailed it. Nailed it by saying that we need to focus on efficiency and effectiveness. And I'll be very honest with you. I think the issue, in my experience, working in government, working in county systems, is that unfortunately most of the peer-to-peer advocates or the peer support specialists, as we kind of call them in the national field or even at the state level, is that they are really at the bottom of the totem pole. They are below the case management. They are under the clinical, and they exist very seldom in management level positions or mid-level positions. So what ends up happening is that all these bright ideas that these peer specialists have, or these peers working in recovery with adults, those ideas never land in the ears of those that can create change. In my county, 68% of the population is Latino and Hispanic. Yet, at the Board of Supervisors, there's only one Latino who identifies as Mexican, who just got elected, who is the first that got elected this last election cycle. Every time we talk about doing something for a Latino or doing something for a Hispanic, the eyes twist, the faces drop. It's almost like we're asking for help, but no one is willing to help us. And that's really due to the political atmosphere that we have, as well as compounded by the factors that exist in each county.
I also think that you brought up an incredible point. I think that our communities need to become a little more savvy in the whole political arena, because in fact, the elected officials are the ones that are making the decisions when it comes to budget for the municipality, when it comes to budget for a city, or when it comes to cutting the pie for the state programs. But you know, we're going to get to that towards the end and a little bit, because part of the whole issue of adaptation, and I want to get into this now, is if we had part of what people can come back to us. If you say there are no services, they say, well, who's going to provide these services? And the fact of the matter is that many of you have already mentioned today that there is not a plethora Latinos that are coming into the behavioral health field. And so, Vera, let me ask you, how have you been successful in attempting to, or what should these agencies consider doing to bring in more Latinos to work for their programs so they can better serve the community?
So that's something that I'm really passionate about, and I think that it's simpler than it sounds, just having the care and making the intentional efforts of letting people know that it's needed. Whenever a Latino or bilingual peer comes in, let them know, that's really a valuable skill, and are you interested in becoming a peer specialist? Can I support you in that? And encouraging those around you, but also going out into the community, having an intentional presence in the Latino community, and literally just like person to person explaining what it is. That's what I do. I explain how it changed my life, how to get involved, and why it's important to make this accessible to the Latino and Hispanic community.
Well, but I think might there also be a need to create, Javier, a cultural sensitivity within programs that are Anglo about the Latino community, particularly, about the fact that Angel noted that 68% of the people in that community are Latinos, and yet the services don't reflect that.
So I would absolutely agree with that statement. I think creating a framework within the Anglo organizations where it's like cultural training, just informing those that exist, which is the majority of the services are Anglo, and the number of Latinos that seek help, like Angel said. The majority of the Latinos in Utah, about 17 or 18% of the population in my county is Latino. It is expected to be about 27 to 30% by 2050. Currently, there are no services that are culturally or linguistically relevant. So the services, like Yvette had mentioned to me a while ago, the services do exist. But I feel like what would be more impactful at the moment as we ramp up and as we create a workforce and as we create the services, modify the models and programs, is to integrate cultural sensitivity curriculum for the Anglo organizations and for those that are currently providing the services. I'll be honest, the majority of the individuals that I know are not comfortable seeking services for some of these organizations. They just don't feel welcome. And that it might not be the case. It might not be that they're not welcome, but that's how they feel. And that's important. That's part of the cultural. You have to create an environment where everyone is welcome. And I do volunteer in an organization that is Latino based here, and it totally feels that way. That might be too much to ask for organizations that are Anglo that currently exist, but at least we can start by educating them on some of the tips and some of the ways that they can engage Latino individuals that come and seeking help.
Well, it may surprise a lot of our audience and even some of you guys panelists to know that about 33% in the decade of the 2000 were Latinos of programs that were funded, discretionary programs that were funded by the Center for Substance Abuse Treatment. Our data folks crunched the numbers for our director at the time, Dr. Wesley Clark, and they came back with 30 to 33% of those clients that non-Latino entities were serving were Latinos. So the folks are going to them. I mean, when a family is super desperate, they will go. But what do we say? How do we work as Latinos to help integrate those programs? Do we go to the leadership of those programs? Angel, have you ever attempted to visit some of the programs that offer services that are non-Latino to try and get them to be integrated?
Yes, I have. And I think here in our communities, most of those platforms are very open to it now. And they invite the discussion. And that's what I like about some of the change that is occurring within some of these organizations. Now, at the leadership level, I will say that it takes people like us, people that have experienced all of these different variables that lead to us seeking recovery or wellness. And we need to be very passionate and explain what that cultural and linguistic framework looks like. Because if we don't share and we don't get away from the shame, or if we don't get away from the fear, those things are going to always exist, because I think that there are a lot of Anglo leadership folks that are willing to, especially those that are in behavioral health. They do have the passion, and sometimes they will partner with you. And I think that it's up to us to really come to them in a way that is not, how would I say, that is more partnership versus and collaborative versus against and highlighting the negativity that exists. And so I have done that, and bringing people from the community. I don't want to be their voice. I want them to be the voice. I'm just there to either interpret or help clarify, because I know the lingo from both sides. And so there's ways of doing it where I think when we empower people to be there, they take back, hey, I was at this meeting, I was in front of some of these folks, I don't know who in the heck they are, but Angel was able to bring me together to these folks where otherwise they would never give me the time or date. So I think that's what it takes. It just takes a huge commitment on our end to sacrifice from our own families and our own work to be able to give them a voice and hope that they then become the future advocate. They learn the system, and they're able to make those bridges between the both.
Vera, thank you, Angel. That was exactly along the lines of what really should be happening. And so, Vera, and George, Javier, did you want to add?
Yes, I did. And just because it's relevant exactly to what Angel said, I think having the courage to speak up and to bring others with you is crucial. But also, I think to something that Vera said is showing up everywhere that you can show up, whether it is a city council meeting, whether it is a community meeting, whether it is a faith-based meeting where people are talking about these subjects. Showing up as a Latino man that is eloquent, that I can speak to the subject, that can speak to the issues, and make ourselves available, and bring others with us as well that are the future advocates that can help us bring awareness to the problem, and also that eliminates some of the stigma and some of the shame. I show up everywhere that anybody will have me. I will speak, I will talk to anybody. I show up to local community, grassroots community meetings, school boards, you name it, I'll be there. I want them to see me. I want them to see a brown person, a person with an accent that is an immigrant, that is addressing the issue and that is there to make the connections. However, I also think that it's very important to bring others with me, because it's not about me. I'm just a conduit. And then even though I do have a story, I think there are other stories that are powerful as well. So coming and bringing more people with me, bringing those with us is one of the ways that we are going to open doors. If at the political level, at the community level, municipal level, county level, you name it. If they see us, they'll be willing to talk to us. And I agree with Angel. Those in positions of leadership right now, I'm willing to listen and are willing to work with us. So we just have to continue to show up. Another important aspect that I wanted to mention, Yvette, and this is quickly, I recently had Odyssey House of Utah is the largest provider in the state of Utah. They have about 500 beds, and they do the majority of the treatment for the underserved and the uninsured. I had a conversation with their president and CEO last week, and I wanted just to kind of connect with you to tell me, what is the percentage of Latinos that you serve? How many Latinos do you see coming in? And then he said, we see a very few percentage of Latinos, and Latinos come, but they leave early or they don't graduate. But they are showing up, but they're not feeling the connection in the process of treatment or recovery, where they feel a part, their culture and their beliefs are being integrated into the process. So they leave early. So he's open to work with me. He said, like, let me know how we can do better. Let me know how we can work with the Latino community. And if you have any models or programs that we implement in our facilities, they'll be happy to it. So to that end, Angel, like you said, they're open, but then we have to be strategic. We have to be prepared. We have to have the systems in place, the models, and the mechanisms to do evaluation and research so we can show them that we are being effective. So it's a combination of all of these things. Thanks, Yvette.
Well, thank you, Javier, because, you know, you and I have had off-screen conversations about, you know, the fact that models don't exist. You know, guys, in the 80s, when the Coalition of Hispanic Health and Human Services organization, and we did do a lot of grant writing. We got a lot of money for the time. I mean, at 34, I was running $1.5 million program in 9 sites all over the country. And we went into that community. We went into those communities. So talk to us about, and I mean into the communities, meaning the Latino communities, and we actually asked them, what is it that's going to keep you, you know, if I'm doing a program for high-risk youth, for example, we talked to the parents, we talked to the youth, we did an immense 360 assessment. And we said, what is it that's going to work here? Because, you know, programs are like politics. It's all local. It really is about what is it that that community needs. And Vera, to that end, I don't want to monopolize the talk with history, but to that end, what have you done within Latino communities? You say that you reach out to the Latino. What specifically are you engaged in to get that community engaged and active? And that question was for Vera. Is she still on?
I don't see her.
I'm sorry. So some specific things that I've done to engage with the Latino community in the Atlanta area. Having a presence at festivals. We have Peachtree Latino Festival annually here at Piedmont Park, and I did have a booth, and I stopped and spoke individually to people to explain our programs. Also, I have a partnership with the Latin American Association and awareness of.
I'm sorry, Vera, I do not hear you.
I'm gonna jump in while she jumps back in. I just want to say that in our county we have this very unique farm worker women's conference where it started about I want to say this will be our 19th year, and the lady that runs that is Lali Mojeno, who's a huge Latina woman advocate for our county. She has done a lot of tremendous work around the farm working community, specifically for women in the fields. And she's come out on many documentaries. But the first Friday of each November, we do an all-day farm worker women's conference where we invite, HHSA is a huge part of that. And we've been able to serve on that very day many of the farm working community, including men, but predominantly the women that come to that conference. And I'm talking about from peer-to-peer services to clinical services to having everything on the spot, because this is a community, in our community, that's very difficult to serve.
That's
because
right.
In the farm working community, they work every day, Monday through Friday. They don't have no time to come to the clinic from 8 to 5, much less to receive services that are offered in a 8 to 5 Monday through Friday type frame. So I think that conference has given us an ability to really penetrate into the farm working community. So I just wanted to share that with you when you talk about how we do it.
Well, you've hit on an incredible note. I think we really need to gravitate in order to expand not only peer-to-peer, but any substance use disorder services and other behavioral health services. We need to gravitate to natural leaders that are advocates, that are going to be knocking on the doors and that are going to be dealing with the broader community in order to bring it home. And you're absolutely right. The rural sector is tremendously even more challenged than any other in terms of finding the resources and implementing programs. Vera, are you back online?
I am back online. Hopefully that lasts. But yeah, it's just making partnerships with other organizations.
Okay. We've talked a lot about stigma in the panel today, and I think that is another area where it really is not only an impediment for the individual that's looking for support or that needs support and doesn't seek it, but also for the broader community. Can we talk a little bit about the whole issue of stigma and shame, Javier? What was your own experience like?
For me, the stigma, I believe, still exists I'm speaking personally, in my life, in certain arenas, in certain areas. It's not something that I feel comfortable in certain areas just bringing up and talking about it, even though I'm learning and I'm getting more comfortable about just sharing my story. I think for my community, the Latino community here in Utah, culturally, and I speak from my own country, which is Chile, it's shameful. It's something that the family doesn't want anyone to know. Don't talk about it. Don't tell anybody, and keep it in the down low and keep the appearances of nothing is wrong, I have nothing to see here. That for me exists within my community here in Utah. A lot, even though there's diversity within the community, I see a common thread amongst all of us where those are kinds of things you don't talk about. Those are the kinds of things that you kind of, I'm okay, nothing is wrong. I don't need help. I got it under control. Those types of responses. But like I said earlier, I think for me, as a Latino man, showing up and sharing my stories to as many places as I can, it helps reduce the stigma and it's helped others see a person that looks like them, that is also an immigrant, that is also a person with an accent, a person that is struggle in multiple ways to adapt to living in this country. I feel like the stigma will always exist one way or another. I think we can reduce it. But my approach is showing up, putting a face to it, and telling my story that can resonate with somebody that looks like me or speaks like me and feels comfortable either talking to me or someone else in their life.
Well, and that was the whole point of Recovery Month, was to get people in recovery to say, you know what, I used to be this and this and this, and now look at me. I'm contributing, I'm giving back, I am right. Whole again. Angel, share with us your own feeling about the issues of stigma and how it really is a barrier, quite frankly, for Latinos, not only to seek help, but to also establish services. You want to talk a little bit about that?
Yeah, sure. Thank you, Ms. Yvette. You know, one of the things about stigma, it's very unfortunate because it is very prevalent to this day. And I decided that when I was fully on my road to recovery, which was at the age of 32, from 32 to 42, it's been a 10-year journey for me. I decided, you know, there is no shame about, and I'm very open about talking about my story, and I'm very comfortable about it, because there's no shame, and you have to get beyond the shame. You know, when I was 11 years old, I was sexually molested, and for that impact to hit me then, and then to go to the most trusted people, which were my parents, and for them to say, hey, let's not talk about it at all from here on out. You know, that was like, okay, well, I can do that. You know, I can hold it a secret. And I realized that was what perpetuated my journey into alcohol, journey into drugs, and what have you. So now I realize the power of coming against stigma is really in our own. It's in us, you know. And so I decided, no, you know, there is no shame about talking about what happened to me, because what happened to me was out of my control. You know, it wasn't my fault. And I think that's where it starts. When you get to that point, when you can feel like, you know, whatever happened, it wasn't my fault. I'm not fearful about it. I'm not angry about it anymore. I am able to forgive and forget and move on. And when people can genuinely see that, and you discuss that with someone who can trust you and listen to you while you listen to them, I think that's the start of it. You begin to change something not only in yourself, but in the people that you come across. And so for many years, I have subtly, you know, you have to be very careful about how you do it. The setting needs to be appropriate, of course. And I think you have to feel that this is your story, and this is you. So as long as you are genuine about it and you feel like you can do it, you can step out of that uncomfort zone, and you will impact that other life. And that's how it started for me.
Very, very good, Angel. I couldn't have expected any less from you. Vera, anything to add in that score?
Definitely sharing your story reduces shame. And I think when we make a connection with another peer with our story, it gets them to keep coming back, and they find themselves in the peer community. And at least that's what happened for me. That's when I realized I was part of a community, was sharing my story and making those connections with our peers. So that's definitely an essential aspect of peer support.
How do we work to reduce this stigma? I know that you said that you make presentations, but is there another way that we can approach this? Because within the Latino community, Hispanic Latino community, I would say that a great deal of what we're facing is really like what Angel experienced in his home. Let's not say anything. Let's really not even talk about it, and they don't take responsibility for what's happened. So how do we change that?
Let's take a look at it from a different angle. You know, in our community, a lot of my people, I say my people because a lot of the people in our communities, they're into like telenovelas. They're into reading. My mom used to read all those novelas on the books. And we started a campaign a few years back to like suicide prevention type work, and we started putting together comic books and novelas that were talking about these things in subtle ways. And so I think that it's the educational part. We have to be very creative and innovative and recognize, you know, what are the people doing? What are they listening to all the time? What are they watching all the time? What's happening in the home environment or in that community setting? And once we can identify that, then we can say, okay, let's get together and put a campaign around some of this, whether it be visual learning or on TV, or however we can really strategize to get this material into their homes is really the key.
That's excellent. Javier, how else do we empower Latinos to take action?
I think I agree with Angel. I think we first pay attention to our communities and our local communities and what their interests are. One of the things that has been very impactful for me or very powerful for me is to bring them in, as in the capacity of advisors or the capacity of collaborators, you know, with like Yvette, we've talked about this before, is creating a peer advisory council, a PAC. Bring members of the community into the conversation, because they are the ones that are in it. And to be honest with you, some of the best ideas come from the PAC, from the peer advisory councils. And those individuals that begin to notice or begin to realize that they do have a voice, they do have something to add, they do have something to say. And it starts to create, like Angel said, that workforce, that future advocates, there's new individuals that are going to come in with you and going to learn not only about themselves, but also the language that they need to speak in different venues. I feel like for me, creating a peer advisory council, including the community in all and every decision for their services and their approach, and include them within their own communities and organized groups, to bring the rest of the population and the rest of the community into the conversation as well.
Very good. Vera, building on what both Angel and Javier have mentioned, what other aspects of engaging community should we be aware of?
I really like what Javier was saying about creating a peer group to talk about what services we might need. I think one thing that we haven't mentioned is working in partnership with the people who give out the certifications too. That's critical in establishing the workforce that we need to provide services. So.
Can you elaborate on that, Vera? Can you tell us how you've worked with them and how you've reached success?
Okay, well, one of the things that I'm working on right now is just trying to make the application to become a certified addiction recovery empowerment specialist, something that's accessible to someone whose first language isn't English. So I'm requesting that in their interview process, there be bilingual cares to evaluate their application as opposed to just English speakers, because this individual does not feel comfortable completing their application in English. So I seem to have gotten some support. Nothing's finalized yet, but it's looking good.
And who did you approach, Vera?
The community outreach at the Georgia Council on Substance Abuse. But I'm also going to be talking to the director there.
Okay. And should communities, Javier, also be looking at the certifying boards in each one of the states?
Yes, absolutely. I think I 100% agree with Vera. And Vera, I am actually going to be attending the CARES Academy because I believe it's an excellent model and I want to learn it well. And I want to bring it to
I want the audience to understand what the CARES Academy is and where it is. So if they have questions, they can direct it to them.
So the CARES Academy is part of the Georgia Council for Behavioral Health, and is the peer certification model that Georgia uses to train and continually educate the peer support specialist. It is based on the Georgia and for Georgia community, but the model itself and the process that they utilize, including the aftercare and the continuing education, I believe is very effective. And I am working currently on attending to graduate their academy and also bring it and modify to Latino speaking and Latino communities here in Utah. So Vera, we should talk.
Definitely.
Okay.
But I do think we need to be connecting with the board certifications in our states. I had a conversation with Brent Kelsey, which is I think you met Brent when you were here for Recovery Day, Yvette. He is the Deputy Director for Substance Abuse Services in Utah, and he's the Division of Mental Health and Substance Abuse DSAM in Utah is the one that handles the accreditation and certifications for the state. So I am currently working with them because they're in the process of revising their certification requirements and model, but also I'm talking to them to, as they do this, to implement and integrate a language-specific model for Latinos and Hispanics, and then also maybe consider other ethnic minorities that might need it. So yes, talk to your state. Your states might be receptive, and then it can help us start and begin the creation of this workforce that we don't have currently.
And have you, and before I go to Angel, Javier, have you approached, I know you, I remember seeing you at a meeting for Faces and Voices for Recovery. How do you think they're doing, and what could they be doing in terms of the Latino sector?
I think Faces and Voices of Recovery, which I'm actively participate with them, are a great organization for RCOs, grassroots recovery community organizations in the community, and also provide tremendous support and technical assistance for peers by peers. I'm all about that. I'm all the peers for peers by peers, all of that. So I do feel that Patty at Faces and Voices should focus a little bit of their efforts in paying attention to the Latino community and maybe either creating a Latino branch of ARCO, the Association of Recovery Community Organizations, and provide the materials and the technical support for these grassroots community groups in our communities that are doing the work, but they're not necessarily organized in a way that I can be more impactful. So yes, and I did talk to Patty, and
I think she's very open to it. I think one of the things she has done, Javier, which has to be applauded, is she's brought in some Latino staffers to headquarters, and I think that with your intervention, let's call it interventions, and others, we can certainly make a difference. Angel, I'm going to ask you to give us final thoughts about areas that Latinos ought to be engaged in creating peer-to-peer, and any resources that you can throw out. Any final thoughts from you?
Yeah, I think that for all those that are seeking to work in the peer-to-peer profession, that they figure out a way to really get invited or even show up to, say, your local health boards, your local committees that are tasked around any type of behavioral health resources, the Board of Supervisor meetings or city council meetings. Those are all critically important, because I think that by showing up and by learning and then by being able to have that as a platform to speak, you're going to be able to really create the change that is so needed. And I think with peers, the great thing about peers is that you're about the only person that can really comfortably share your own experience with that other person, because the clinician or the psychologist or the psychiatrist, they're all there to provide, and they have their part to provide the help, but very seldom will they even share their own lived experience, just because that's really not their role in a sense. And so I think if we would see more of that happening even at that level, we would see a lot more people well. That's the integrated care. That's the holistic care that not only the peer should be doing it, but all of the people that are involved in that person's wellness.
Absolutely. Any final thoughts from Javier Olvera?
I just want to build the workforce. I can't stress that enough. Just encourage peers that are Latino, Hispanic, bilingual, I just share how much it changed my life. If we can do that, that's going to be the gateway, at least for us here in the Georgia area.
Excellent. Javier?
I do want to add, piggyback on what Angel and Vera said. Both points are at the top of my list as well. I think creating partnerships and connections anywhere and everywhere you can, it's always, always helpful. If you don't know what to say, or if you're confused of what do I do, or even if you are an ally of the movement, of the efforts, contact one of us, or contact anybody at the Latino ATTC or the association, and then go to their websites and find some talking points that you can just express at various venues. It's important that we are seen and heard in every location and every spectrum of the continuum of care, from
Absolutely.
prevention,
Absolutely.
prevention, treatment, and recovery. We gotta be seen, we gotta be heard, and we gotta be open to collaborate with everyone.
Excellent way to end this fabulous panel presentation. Thank you. Maxine, I'm turning it over to you to manage the questions and answers. Thank you, everyone.
Thank you.
Thank you, Yvette.
Well, one of the fastest hours I've ever lived, for good reason. It was so engaging. I appreciate every single one of you for what you did here. I'm actually going to stop my share. We all know we're at the Q&A portion here. What I would like to do is present the questions that we currently have by all of our participants. Remember, if you have any questions, please ask them in our Q&A box in the center bottom portion of your screen, and we will get as many of these questions answered live as possible. Okay, so let's start with the first question. It is addressed to the entire panel. Maria Lapine asked, how important is it to have a peer understand the culture and language of the person that they're working with?
Very important. I want to jump in there real quick.
Yeah.
Maria, it's extremely important. And I think it was Vera who said, you really need to just listen to that person. And I think part of our job is to not just listen for that hour or for those 5 hours. It's to really wear the cap of listening to that person for more than just, the hour or the 5 hours. In other words, I think we should be doing a lot more listening than talking. And by listening, I feel that when the time is right and we're sharing and we're asking the questions, tell me more about that. Tell me more about how you live, how you experience living. How does it look in your own household, your own community? Those appropriate questions will then get us the answers that perhaps can help us and help them really find that correct resource and identify what resources. If none exist in their own communities, well, shoot, that's what we're here for. We need to really advocate for them because that's the system we work for. So we need to leverage those resources and create them in those very same communities. So I think that listening is really, for me, the one thing that perhaps can help in a situation like that, to learn that language or learn that culture.
I wanna add to what Angel said. From my perspective, first of all, listen. It's crucial, and then also pay attention to the nuances that a culture involves. I remember, we gravitate through doors that look like us and speak to us. We touch, we hug, we kiss in the cheeks. We are emotional, we are affectionate, and then we utilize humor to communicate. So those aspects, I think those are some of the aspects that permeate through all of us, depending on culture or where we're from. I think we can kind of some more than others, but I think those are areas that are important. As I am speaking with a peer that is a Latino, if they lean in to hug me, I'll hug. If they lean in to kiss me, I'll kiss in the cheeks. Those are aspects that create that environment that is comfortable and it makes them feel like we're one of their own.
Great. That is That's awesome to hear. So along the lines of culture, Maria also had another interesting question. As experts in your field, what would you all say or do to help someone when cultural values maybe are getting in the way of them seeking help? For instance, the adage that we don't talk about this outside of our homes. You know, I grew up in a very traditional Chicano household, and it was sinvergüenza. You know, do you not have any shame about this? So we don't talk about it. Or the idea that behavioral health as a whole is taboo. How do we help somebody kind of overcome those, what might look like inherent barriers or protective factors that aren't necessarily protecting us in that moment?
I'll jump in here. Sorry,
Oh.
Go ahead, Vera. I'll go after you.
Okay, I was just going to say, again, just sharing the lived experience, like Angel was sharing his story, just how letting go of that stigma and being open may have supported you if you have an example of yourself, or you have an example of another peer who also has overcome that same stigma. And for them, in the end, it was better for them to let go of the shame. Always sharing that lived experience as a support.
I ditto. And I was just going to say something very similar to what Vera said. I was going to say that perhaps in the first time or the first interaction, the first meeting, the other person is not going to be inclined to share their story. But I think if I share my story, I share my lived experience once, twice, 3 times, however many times it takes, that person is going to come around. At least is going to open up to me maybe, or to whoever the peer that they're working with is. So yeah, Vera said, share your story, share my story, share a personal experience, and then don't expect the other person just to come right back at you and spill it all out for you, because that might take a few meetings or a few times.
So really quick, I think that just a helpful tip that works for me is to relate to them that, these types of issues not only exist in layman persons like them and I, but also some of the most, wealthy or more recognized or famous people in the Latino, Hispanic community media, that this affects them as well. And so when we can share their story and we can ensure the HIPAA, we have the Health Insurance Portability Act, where we have a fiduciary duty to really keep that information confidential, and having them really understand what that means may help in them trusting us to share those things that they might not otherwise want to share. Because confidentiality is something that perhaps is not spoken very much. We don't sit in front of a client and say, oh, let me just kind of go over HIPAA with you right now and share with you what that all looks like. We do that with our employees, but not necessarily with our patients or with our peers that we're coming across wanting to hear their story.
Angel, may I, Maxine, just comment?
Of course.
42 CFR Part 2, which is the statute that rules on privacy issues, is being threatened. I encourage anyone who has a concern related to that to go to the Legal Action Center, which represents the interests of people in recovery and addiction issues. They're out of New York, and learn what's going on, because we need to be very vocal about safeguarding the records and keeping them private. That's all I'm going to say. Thank you.
Well, I appreciate you bringing that up, Yvette. Actually, our project director, Dr. Pierluigi Mancini, is working really diligently on a work group so that we make sure that we are advocating as an addiction technology transfer center, as community members who, as all of you have said, have a voice just like our peers in the community do, but that if we need to be the first person to say it, to open up the floodgates for everybody else to say it, then we're willing to do that. So please, you'll get our contact information at the end of this panel. Kind of stay tuned so that we can update everybody on what we are trying to do to help protect this information from not crossing paths with other information, but also what the community at large is doing for other people in recovery. Really important. So thank you. We have some pretty amazing questions. I do want to say real quick, I absolutely agree with what Angel said, is it's not just us and potentially our neighbor. It's other people that we see. You know, the first person that came to mind was Demi Lovato, who's a young person, a pop star, and, you know, it was such a good window, especially for young people, to see, like, young people go through this too. People with money go through this, people with fame, and that it's a real struggle, but that recovery is possible.
I think what's important too for our community is that people of faith as well go through this. And that's something that it's very impactful, and especially in my community where faith and religion are very important. So to point that out too, it's helped me.
Yes, great. I agree with you. So I'm going to kind of lump two questions together, but I want to give credit to the participants for asking the questions. Maria Lapine asked, what if I don't have a story, but I want to help someone, what can I do? And then that was followed up by Sonia Acosta Hastings, who said, how does a non-peer get involved without being in recovery themselves? Who would like to tackle that first?
I would like to jump in very quickly. I just want to say that, sorry, Angel, allies are so crucial to the movement. And so if you don't have a story, but you have a loved one, or you have a friend, or you have a family member that has struggled with either mental health or substance abuse, you do have experience. And you do know what the families go through, and your voice is important. So share your story from your perspective, because it's also an important part of the puzzle. Sorry, Angel, didn't mean to interrupt you.
Not at all. I love what you said. I think it was along the lines of what I was going to say, is that, you know, when I did a lot of work for the LGBTQ community, I don't identify with any of those, and I identified as an ally. So I think when we say we don't have a story, I think we all have a story. It's just taking the story from a whole different perspective or viewpoint. You are just as valuable as I am as valuable, whether I have lived experience or not, because the ally can also play their part in really the wellness and recovery model. So for whatever it's worth, I think that, you know, like Javier said, that as an ally to the LGBTQ community, I learned a lot about how they struggle, how they identify, how all the issues of mental health are perpetuated just by either being identifying as transgender or something like that. So as an ally, I was able to understand that even to a greater depth, and was able to work together with them so that I can represent that in the systemic change or in another change. So you're always a change agent no matter what hat you wear.
Amen.
Beautiful. So that's what some of us would consider vicarious experience. And as the gentlemen are saying, and I'm sure Vera would agree, it's just as important. So please, all of us have a story. I really highly recommend, again, that you go onto our website and you take a look at the recorded version from last week, where we highlighted a panel of young people in recovery. And many of them, you know, of the 4 panelists, they talked about their vicarious experience, and that was kind of their first window into this world, right, where it was apparent that they saw going through this. And so how did that even start their journey, or how did it impact their own journey? And a lot of us can say that we know somebody, or we love somebody, or we might have even lost somebody to this. And so please show up as an ally. That's just amazing. We have a question, first a comment and then a question from Jairo Hernandez. I hope that I got your first name right. Please forgive me if I didn't. Jairo said, Angel's point that using entertainment to normalize diagnosis is interesting. My mother watches a soap opera where a very beautiful female actress is bipolar. or lives with bipolar disorder. It normalizes the issue and destigmatizes. So the question that follows is, how can entertainment executives be encouraged to place characters with mental illness and maybe even substance use in their shows, such as the gay community did with the proliferation of gay characters on TV? What are some tips that we can give these executives who hold the purse strings?
I think Angel is in California, so he's got this one.
Well, let's not make too many assumptions, right? I think the entertainment in California, it stems from California because of Hollywood, but it's not a very easy industry to tap into. And I think that, unfortunately, people like myself who don't have, say the Hollywood connections, we start with our legislative platforms because they do, and they talk all the time. And so the pressure, we leverage like LULAC, the League of United Latin American Citizens. We leverage NAMI, the National Alliance of Mental Illness. We leverage these nonprofit organizations to really help us get into those, if you will, entertainment venues because they are there. And so the more we can leverage those resources, those national level ones, the more we can get our work into changing that. There's public radio, there's public TV, and those are some of the more easier ones to contact and to do work around that. So for ours is the public broadcast system, PBS. They've done a lot of work around behavioral health, mental health. They've helped us really put our story in the entertainment industry. So you can start small like that and then just work your way up through those types of organizations like NAMI and LULAC.
I agree. Yvette, do you have anything to add here? I know that you've done a lot, with the TV and the radio series, Road to Recovery. Our IT guru recently shared a link to the show with Mr. Quinones, What Would You Do? And it was around substance use. Anything to add there, Yvette? You're on, my dear.
I did, and how about now? I think, any sort of media is powerful. I think we need to just harness its strength in a way that we can present what our needs are, that we can engage the community in education through any means possible. It can be social media, it can be a blog. I know I promised the Recovery Month people I was going to do a blog during the month of September for Recovery Month, and I've got to go back to that promise. But anything that we can do to express how things are going, what things are coming up, and do it in a way that your audience, if I can say that. Know who is listening to you and how you're presenting that information so they can absorb it and they can act on it, just like we're doing here today.
Great. Rick Thompson had a question. He actually has two questions. And Vera, you might want to start the answer on these two questions. So I'm just going to kind of collapse them into one longer question. Rick Thompson stated and then asked, Angel mentioned that peers are often below case managers in agency hierarchy. He has found that this is also reflected in the salary for peers. What do you think can be done to address this salary disparity? And then additionally, he stated that at his agency, they struggle with getting peers with lived experience cleared to work and to do outreach in the jails, oftentimes because they have a criminal history of their own. Any experience with this and how to address this as well? Vera, would you like to start with that? We may have lost our audio again. Javier, Angel, would you like to get started on that until we get Vera back?
Yeah, from our perch in California, this is a very huge systemic issue. Part of the problem is that no one sees in the hierarchy of salaries, to see a peer making more than a case manager is already a problem in itself. And so the thinking that goes around setting up the salary structure is that peers have no experience, peers have no education, peers are coming off the street, and therefore their salary should be at minimum wage, if that. And that's very unfortunate, because the way I've seen the peers really advance wellness and recovery in a behavioral health system is that without the peers, you would have more people falling out of the system than actually receiving the services. So there needs to be a change in the governance, if you will, of the systems. And the way you do that is you promote maybe there has to be a peer specialist career pathway. And when I was in California, that's the first thing I did with a few colleagues of mine, Sharon, if you're listening in, I give you kudos for all the work you do around peer support specialists. But we created a peer support specialist pathway through the Office of Statewide Health and Planning Development to ensure that at the very least, the peer support specialist doesn't have to stay at the bottom. They have a career pathway to go to the top. And so we identified this using Jeff Oxedine's model of career pathways. And so I think that there needs to be more done from us who learn how the system works to change the system. And so that's kind of how we approached it from our end. Yes, the pay is not much, but they don't have to stay there if they don't want to. There is a career pathway in California that they can utilize to move up and get more pay for the work they're doing.
Great. Vera, would you like to jump in now that we have you back?
What are we discussing? Because I was just out of the room.
It's okay. We want to know if you have any tips about addressing the disparity in pay for peers versus those who are maybe clinicians. And then additionally, if you have any experience with having trouble getting folks approved to do outreach or service in jail or in the criminal justice system because they might have their own criminal history.
Oh, okay. Well, that's something that we've made progress with here in Georgia. The Department of Behavioral Health is very flexible as far as criminal background, so that's not something that we have to worry about too much as peer specialists. I will say when I started off my first peer specialist job, it was still significantly greater than what I was making in retail at the time, and my next position made more money, and the job position that I hold now as a peer specialist, I'm very grateful for, especially not having the opportunity to complete college. It's really given me another chance, another start of life, and that's one of the reasons I'm so passionate about sharing the awareness of the certification and what it can do for you.
Great, thank you. You know, a thing that is gaining some traction is the ECHO model. It started in New Mexico at the University of New Mexico, and it's such a great model, very much like what we're doing now, where peers who might have a criminal history could actually work with peers inside the criminal justice system via video conference. And it's actually done some really impressive things. Peers are doing a ton of training where they start while they are still incarcerated, and then once they are reintegrating back into the community, they're able to, again, go back as a peer also with a non-type of lived experience. So I really recommend that everybody check out the ECHO model. I believe it is unm.edu, and you can search their site for information on the ECHO model. All right, so I am going to see if we have time for maybe 2 more questions, which is always a good spot to be in, right? So George asked, I don't want to chop up your last name, George, what works to organize services for Hispanics that does not imply a secondary agenda of record checking and deportation? What do we think we could do for our members so that we know that
Well,
they're
I think we need to protect them, and I know through behavioral health, especially through alcohol and other drug programs, at the very moment there is no data sharing with ICE or with the even with the local census being done. There's assurances that none of that data will be shared with these type of immigratory organizations. So, you know, we rely on that confidence. We rely on that word. It's never our intention to use data. We just use very certain data sets that don't identify any particular person or any particular individual, if you will, that may not have insurance or may not have any legal status in this country or in our state. So they're very well protected. And I think it's up to us too, to the administration. It's up to the leadership to really rely on that confidence and advocate for these folks that are seeking services, and not violate that confidence, because I can tell you that, at least from our perch, we sustain that. And I don't care if the sheriff's knocking on our door or ICE is knocking on our door. You're not going to get that data. You can take me to jail, and then we'll figure it out from there. But I'm not going to release that data because there is no federal or state law requiring me to do so.
Great, love it. So Katia Macias asked, which organization do you recommend to be contacted to find substance use statistics amongst Latinos? Katia, I would definitely recommend going to SAMHSA. That's SAMHSA.gov. Additionally, you can go to pewresearch.org. That's pewresearch.org. They actually have Hispanic Center in their research that gives a ton of information. They do a lot of work for the Hispanic and Latino community. So I will add it to the chat here before we close out for today. One last question, and that's what we'll end with. We had a question earlier that said, Marielle Irvin asked, is there a limit of time someone in need can actively be in the peer-to-peer support program? Are there certain necessary requirements for somebody to be actively engaged in peer-to-peer services?
From my perspective, just wanting to be in recovery and stay in recovery, that's the only requirement. Length of time for receiving services, there's no length of time. Recovery is an ongoing process. So as long as you want to stay engaged, you can leave and you can come back later. Whatever. It's a long life commitment. Let me just say that, to support the individuals in recovery, because recovery doesn't stop. You don't graduate and be cured from it. You're always working on it.
Yeah, I concur with that statement. I think there's no limitation of time. We have even wellness centers that we've been promoting for the aftercare and weekend kind of model, where in the traditional county government behavioral health setting doesn't exist. And I think through the wellness centers, some of our peers are finding an avenue to really dedicate even more time. So there is no such thing as a specific time. I think it's just a matter of how well the individual feels and what they see as their time management for this kind of work.
I think an element also to include to that on the wellness centers, thank you for saying that, Angel, is that, one of the best practices for me to sustain and continue my recovery and it strengthen my recovery capital is be of services and be of community engaged. So you can continue to stay engaged or continue to be a peer in peer support, but you can sort of graduate to being a peer mentor yourself, to continue to to volunteer in activities in the community, do tablings, do outreach, do education, do advocacy. And there's so many ways to continue your peer-to-peer mentoring in your life. It doesn't necessarily just has to be while you're in an incidence of use or in immediate crisis mode.
I agree. And I apologize for autocorrect. I did not know that that happened on a Zoom call or webinar, but it's pewresearch.org and samhsa.gov, not samosa.gov. Please don't go there. I'm not sure what that is. So this concludes our panel today. I want to thank all of the panelists. I would love to thank our moderator for such an amazing job, for being such an exemplary panel and moderator. Also, all of the participants for sticking with us today. Please go to our website. You can also email us directly if you have any questions, if you want more information on how to access training, technical assistance from our ATTC. And finally, a friendly reminder to please fill out the satisfaction evaluation. You will be immediately linked to the survey. I promise you it won't take you more than 45, 90 seconds to complete this. It really does help us to improve our training sessions, to bring you more sessions, and it lets us know how we're doing. So Angel, Javier, Vera, Yvette, I thank you. Happy Recovery Month and happy Hispanic Heritage Month, everyone.
And we thank you.
My
Thank
pleasure.
you.
Thank you.
Thank you.